At 22, Zahara Nyakaisiki should be living a carefree life, but instead she's going through a period of social exclusion, worried about how she's going to foot a 9 million shillings bill to have her jaw removed, and if more funds can be found, undergo reconstructive surgery.
How did it come about?
In the place of Nyakaisiki's chin is a huge swelling that extends far to her left jaw. Her lower teeth have shifted out of position. The resident of Namungona in Kampala City's Rubaga division is scared of going out, intimidated by the stares she gets whenever she steps out of her parents' home. One morning in 2015, when she was in primary 5, Nyakaisiki noticed a small fluid-filled bump on the inside of her mouth. It was no different from other bumps that had come and gone before, so she ignored it.
But this one, it failed to go. Then it started swelling time to time, but it was really small because it was growing on a slow base. I first did the first test in Mulago. They told me that I have Kaposi sarcoma.
Kaposi sarcoma is a rare cancer that causes abnormal swellings to grow on the skin, lymph nodes, mouth, nose, or throat. However, the doctor who interpreted the biopsy results said a mistake had been made in the tests. Meanwhile, the swellings, which were painless, grew steadily. By the time Nyakaisiki was admitted to Senior 1 in 2018, she could not stand the curious inquiries from her peers and teachers. She decided to drop out of school.
We looked for another money in order to do another test. When we did another test, they told me I have mandibular ameloblastoma. They told me the whole jaw is infected. So they referred me to Koso.
The young woman admits that at Kosu, the consultation and review fees were reasonable. Unfortunately, several family friends advised the family to seek treatment from herbalists.
They requested for 9 million point something just for the operation minus the treatment. I'll get to know the money for the treatment when the operation is done. I tried using different things to see that I get better, but they all failed.
According to Dr. Anna Margaret Bira, a maxillofacial and oral surgeon and the head of Makerere University's Dental Hospital and School, mandibular ameloblastoma is a non-cancerous tumor that grows in the lower jaw.
It originates from the tooth-forming structures of the jaw. Most cases, by time of diagnosis, we usually meet these patients when they've taken even 3-4 years.
Ameloblastomas are not infectious, but if left untreated, the tumor can grow large, distorting the shape of the lower face and jaw, as has happened in Nyakaisiki's case.
This swelling, the causes are real multifactorial. It's not one. We can't say only one is the cause, but we have environmental, we have genetical, and all other factors. They all interplay. And as we've seen, it's more in male compared in female.
Dr. Bridget Nakazibwe, a dental surgeon with Premium Dental Clinic, says any person who is still developing teeth is at risk of getting mandibular ameloblastomas.
It's at least every 6 months in a year, that is like once a year, you go for a dental checkup. Every day, every person who goes for a dental checkup, you have to get a routine X-ray that we call an OPG. It takes a view from this side of the jaw to the other one. So most of those that problem can be picked up at an earlier stage on that routine X-ray.
Before 2015, when her troubles began, Nyakaisiki had never attended a routine dental checkup.
It's hard because I do feel pain when my mouth is closed for a long time. When I sleep on this side, I do feel pain because this side is really swollen more than this side. So most of the times I sleep on one side. I feel out of place because I face a lot of challenges. Some people do laugh at me. Some people gossip about me.
Surgery is the most effective treatment option available. Dr. Bira says in the early stages, when the tumor is less aggressive, surgery is carried out to remove only a small part of the affected jaw. However, if the tumor has progressed in size, the whole jaw must be taken out.
To fully treat a patient with ameloblastoma, and more especially when it has fully grown, it can go to 65 million. the bare minimum if you want to treat this patient very well. Because apart from resecting that part of the jaw or removing that part of the jaw, then you have to put something for this person. So you have to get a fibula graft, a bone from another part of the body, shift it to the mouth. After shifting it to the mouth, because remember this jaw has gone with the teeth, then you have also to put the teeth. That's another big cost.
Although malignant ameloblastomas are rare, the complications from the swelling may be fatal to the victim.
Yes, it can kill, of course, if it starts encroaching on the vital organs, especially if it is in the maxilla, and then even the mandible, because it enlarges and it goes towards the neck. You don't want that.
You can't even eat very well because most of the teeth are in it are mobile, so it affects your feeding, it affects your esteem, it can even compromise your airway.
Nyakaisiki appeals to the general public to help her contribute towards the surgery to remove the tumor since it's growing every day.